welcome. Then you're going to introduce yourself, and we're getting right to it. So, welcome to the Health Help with Dr. T. As you guys know, I'm Dr. T. Thank you so much for joining today. Remember, all information that you hear on this live, on this page, is general information only. If you have specific questions for yourself, for your loved ones, please reach out to your healthcare professional. You can reach out to Dr. Brusola if there are any specific questions that you have. So I would love to introduce you first before I allow you to introduce yourself. This is Dr. Gregory Brusola. He is a dear, dear, dear friend of mine. I feel like he is he's brilliant. Like, name it, he probably knows a little bit about everything. He's a physical therapist. I'm going to give you an introduction. And has a lot of specializations while also being a professor. But he is the one of the people that I can call and say, hey, I'm trying to embark on this, whatever I'm embarking on. And he's like, let me know where you need me. And so I'm glad we're able to make it work today. Thank you so much for joining, Dr. Brusola. Go ahead and give us a quick introduction, and then we'll get started.
All right. Thanks, Dr. Tomei. Yeah, thanks for having me on. I'm super excited to be on here. I know I've been planning on it for a while now, so I'm finally glad we got it scheduled. But yeah, my name is Greg Brusola. I'm a physical therapist. I actually worked with Dr. Tomei for quite a while back when we were clinicians at Tier Memorial Hermann. So we got to spend some long days together. So good memories. And yeah, I graduated with my PT degree back in 2014 and my PhD in 2020. I transitioned over to a faculty, so teaching and research role down in Galveston at UTMB, and teach and do research in the PT department over there. And now here I am.
Yes, yes, yes. You are just amazing and just a wealth of knowledge in so many different things. So I want to start with the basics. So obviously I am a PT, but not a lot of people here probably know that world, of have been involved with the PT world. So some of my questions I'm going to ask, you're going to be like, now, Dr. T, you should know that. I most
All
likely
good.
do.
All questions are good questions.
Yes. So I am going to kind of speak for the audience, and they can go ahead and ask questions as we go. So what is the difference between a physical therapist and a personal trainer? Why
Oh
should
my
I go see a
gosh.
physical therapist?
Well, there's a big difference. So there's a lot of overlap, but there's really a big distinction, and that, of course, is our wealth of knowledge that we have in human movement and the underlying pathologies that underlie pain, movement dysfunction, injuries, and all of that. So if you ever have an injury, you know, the individual that you should be seeing is a physical therapist, because we know what's going on at the tissue level, at the healing level, and of course at the whole movement level, functional level. And we can address and pinpoint and diagnose what those movement dysfunctions are, compared to a personal trainer who might have a lot of knowledge and skills in biomechanics also, but really in terms of the pathology and knowing how to treat that pathology or underlying issue, physical therapist is definitely the way to go.
Awesome.
And of course, our education, we're a doctoring program now. So that's a huge thing. Not only do we have 4 years of undergrad, we also have 3+ years of our doctorate degree, plus a residency and fellowship if we decide to do that.
Yes, and I think that's amazing because the field is growing, right? To where, like you said, now there's, the doctorate program, there's the fellowship, there's a residency if you choose to go in that direction. So are you telling me that, let's say we're gonna come back to that back pain, because there's a reason why I put back pain in our label. Today I went to my doctor's appointment for like an annual, and the lady that drew my blood said, "Oh, what do you do for work?" Because I had on scrubs. And I said, "Oh, I'm a physical therapist." And she said, "Oh, I've been having this back pain." And I was like, everyone is having back pain. So we're going to come back and talk a little bit about that and what that kind of causes. Talking about physical therapy versus, not just personal trainer, but other fields also. There's also chiropractors, right? We also get that, oh, why should I go see a physical therapist? Why not just go see a chiropractor? Or my doctor keeps pushing chiro and not PT. What is, in just layman's terms, what's the difference between a PT and a chiro? in your
Yeah, so
opinion?
so yeah, Chiro is a doctor of chiropractic, right? So their main interventions are those hands-on manipulations. So if you're ever on TikTok or Instagram and you see those reels of people's necks getting popped and people's back going, that's primarily what chiropractors do. That's their primary
Mhm.
mode of intervention. And we do that too as physical
Yes.
therapists, but our primary intervention is definitely the therapeutic exercise that ensures that, whatever we do stays that way. So you don't have to come back to us anymore after your injury because we've strengthened you, we've given you the tools that you need to do in order to be pain free or painless and move better. And so, chiropractic is moving towards that also in terms of more kind of active
Mhm.
interventions. But primarily, their primary interventions would consist of those manipulations or mobilizations versus what we do as physical therapists, mostly those therapeutic exercises that really make a big difference in the long term.
Absolutely. For those manipulations, mobilization is just to increase range of motion throughout your body. And so that's more the chiropractic. And like Dr. Brusola said, is not only do you need that movement, you need that strength. So would you say, in your opinion, that a chiropractor and a PT working together is optimal, is ideal? Or would you say stick to one, that's good enough?
Honestly, if a team is there, it's better as a team because we each can work on our own focus. So a
Mhm.
chiropractor, you might need some mobilizations. Might need some of those joints to get freed up a little bit, and that could help and facilitate what happens, improvements in physical therapy. And we can do those too. But sometimes chiropractors have other techniques that we might not have, and we have techniques that chiropractors don't usually use. And so we can complement each other very well. So I don't really like to say, don't do chiropractic because, it could be helpful to people, right? And a lot of people do value chiropractic and have had positive effects and benefits from chiropractic. So if it works for you, go ahead. But definitely, when you see a physical therapist, prioritize kind of the long-term fixes that we're trying to give you.
So yes, we want to see you. I'm butting a little bit. We want to see you, but we don't want to see you forever. We want you to get back to function. As much as we would love you in our clinic, our goal is to improve function and get you back to society. Okay, Dr. Brusola, I know you have some specialties. One of them is multiple sclerosis. You are certified in that population. Can you tell us a little bit about just what the demographics really are for patients with MS?
Yeah. So I treat patients, or I treated a lot of patients with multiple sclerosis, and that's kind of where my research is going to now as a researcher. And so people with MS are usually in their younger ages, like young adult ages, in those career ages. So
Mhm.
anywhere between 25 to 35
Wow.
years old is where you'll find most of our patients with multiple sclerosis diagnosed. And right now, it's more prevalent in Caucasian or white people. But what we're seeing is an increasing incidence in minority groups like Black Americans, African Americans, and Hispanic groups. And what's also important to consider is with those kind of BIPOC groups is that they tend to have a more aggressive disease course than
Mm.
other people. So I really encourage early on for all of patients with multiple sclerosis, especially when I go talk to some of those support groups and self-help groups with the National MS Society, is to see a physical therapist early on in their disease process to build themselves up. So if they do start declining, it's not as fast, it's less severe, and even for a lot of patients can help reduce the amount of relapses and the amount of progression of the disease. So it's really important to look at early intervention versus trying to fix what already might be kind of broken a little bit already.
Right. And I bring that to kind of segue into the research world, right? There's so much that occurs, and not necessarily just MS, not necessarily just patients who've had a stroke or anything like that. There's a whole world behind what physical therapy does and how they come about, how they come out with these regimes or exercises and things like that. Some people think, oh, I just go to a physical therapist and I can do those things at home, or I can do these bridges and heel slides or whatever. But there is this research behind what we do and why we do it and how we do it. You're heavily involved in research. You're heavily involved in case studies and things like that. Could someone, not necessarily someone that had MS, but just anyone with any injury qualify for certain research? And what does that look like for them?
Yeah, so anybody, depending on kind of what the area is, can be appropriate for research opportunities. And you just have to look what's out there. Universities publish a lot of research opportunities on their websites, hospitals also. And it's just a matter of going online, even just Googling like research studies on back pain or research studies for multiple sclerosis, and they'll pop up. And then you can see from those advertisements what the criteria is to be included or be a part of those studies. And so it's really important to look at and consider what those inclusion criteria are, what makes you eligible for a research study, because sometimes a lot researchers make sure that the results are understandable, interpretable, and can be generalized. They have to make sure that they do have certain inclusion criteria that won't make things too messy. Like you have everybody join in a research project, right? And they're all different characteristics, all different demographics, all different backgrounds, then trying to interpret all that can get a little messy. So really trying to look at, okay, am I qualified for this study is going to be a big thing in terms of making sure you don't get disappointed if they say, I'm sorry, but you're not qualified for
Like
this
for it.
research project.
Yeah, and it's interesting because I'm also a little bit, not like you, little bit involved in research. So I get to see just the behind the scenes, and I get to see, I call it free therapy for some of our patients or even some of the participants that join. On the top of your head, could you mention, I'm not going to make it too hard, 6 to 7 diagnoses of patient population that you've treated?
Oh, okay. Stroke, spinal cord injury, MS, Parkinson's, orthopedic injuries, post-surgery like hip
Yes.
replacements, knee replacements, geriatrics, so older individuals that need conditioning, and cancer populations, and of course limb loss. I think that's more than the six you told me,
Yes,
but
you've
a lot,
definitely gone
right?
over
A lot.
10.
Yes, sorry.
Yes. And I
Yes.
wanted to highlight that because, most of our audience, they're in this sandwich generation, right? Where we're taking care of our elderly parents and we're taking care of our young ones, our kiddos. And I wanted to kind of highlight what physical therapy can do for your parents, is as they get older, or, I call it younger, right? Their bones, their muscles, their nerves, things, they don't bounce back like they used to. They're not moving as fast
Mhm.
as they used to. So could physical therapy be a preventative measure that could help that could
Hey.
help them,
Uh-huh.
reduce falls and comorbidities and things like that? Talk a little bit about that.
Yes, 100 million percent. So the big job of physical therapists is prevention, right? We want to prevent things from happening, from illness, from injuries from happening, because if they don't happen, it's a good life, right? No cost, no burden, no time away from work, from play, etc. So 100% like prevention is one of the things that we do. One of the biggest tools and most important tools in our toolbox. And I can give an example of my parents. So my
Mm,
dad's 80. He just turned 80 2 weeks
wow.
ago, but he still walks outside for about 2 miles. He goes up and down ladders. He works on the garden. He mows the lawn. He does all the
Wow.
yard work. So that's a lot of manual labor. And that's
Mhm.
because I pushed him, especially now that he's older, to ensure that he's exercising. So he does weightlifting and he's doing cardio. And that's his walking 2 miles every day to ensure that he has that capacity, that functional capacity to keep going. My mom, even though she has a lot of back issues. She has a lot of arthritis.
Mm,
Um, I still push her to be active. Like every night she's on TV on YouTube doing like the little dance videos that she can follow along with. And she goes to the gym. She swims
Yes.
twice a week. She does weightlifting once or twice a week also, and goes walking every day. And so it's the importance of prioritizing your physical health and well-being that can trickle down into other domains and areas of your life that can really uplift and make sure your quality of life, especially as you get older, doesn't decrease or diminish as quickly as somebody who doesn't exercise or isn't engaged in some regular physical activity on a regular basis. Because our bodies really are what keep us going every day, right?
Yes. 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 Good point. Wow, I didn't know your dad was
He's
80. I didn't
80
know he was
years old,
80.
and he's more active than I am. He does all the yard work. I'm like, you do that whenever
Right.
you want me to do it, just tell me. But he's all for it.
So obviously, we don't want you guys to go home and tell your parents to go to the gym and start weightlifting, right? But what are some ways to motivate our parents? Like, for example, my parents are pretty active. Like, my mom is a busybody. She loves to walk. The way at the rate that she walks, is like I'm almost running to keep up with her. My dad used to cycle and he used to play tennis, things like that. But that was something that was part of them, right? I didn't really have to push it. Before, I used to kind of lie to my mom when I was in PT school. Sorry, mom, that I always left something upstairs because I wanted her to do stairs training because I think stairs is obviously super important. And so I was like, oh, mom, I think I left something upstairs. And she'll be up there looking, and I don't know, there was probably nothing there, right? And then like 2 weeks later, I would go back up and I'm like, oh, mom, I think I left something. But I wanted her to get that stairs training in. What are some ways to motivate our parents, those that aren't, athletic backgrounds and they just want to sit and watch CNN all day? What?
You know, that's a really good question, a very complex question, right? If it
Yes.
was an easy answer, everybody would be exercising, right?
Right.
And a lot of it is, like you said, their prior experiences, right? If they were an
Right.
athlete or they were active back then, if they were never active, then it's going to be really much harder to push them and motivate them to do some physical activity, right? Cultural. There's a lot of cultural
Yes.
influences too to physical activity and exercise. And
Hmm.
then you have to think about their comorbidities or other health issues that they have that are already keeping them from engaging as much as they might want. There's also, thinking about, what's their self-efficacy or confidence about doing exercise,
Hmm.
right, by themselves. Because if you just tell them go exercise, they're gonna be like, I don't know
What do I
what
do?
do I do, right? So, there are a lot of different strategies you can do with your parents. Maybe it's go walking with them every
Yeah.
day, right? 20, 30 minutes, go walking with them. That's the easiest step you can start with is exercising with your family, with your
Yes.
parents. Maybe start planting the seed. Hey, like you, Dr. T, you've got, your kid and they have their
Right.
grandchild, right? Their favorite
Yes.
grandchild. And so, motivating them through play and
Yeah.
interacting with their grandchildren. That's going to be a big thing because they want to do that, right? It's not like, oh, I
Hmm.
don't want to play with my grandchild. Keep them away from me. I mean, there might
Right.
be some grandparents like that, but for the most part,
They
they
want
want
to.
to play and be active with their grandchild,
Right.
get on the floor or pick them up, right? Or be able
Yes.
to chase them if they happen to run across the street. So even
Hmm.
like planting seeds like that, like, hey, to be able to keep up with your grandkid, like,
Yeah.
why don't we do X, Y, and Z, right? Sometimes exercise can be challenging by yourself also.
Yeah.
Like, how many times have you been unmotivated to go to the gym or exercise, right?
Right
Exactly.
now.
So that so that's where again, being with your parent or
Yeah.
maybe both of them going together or maybe them joining some senior group fitness class, right? So community classes that
Community
do have
classes.
physical activity incorporated in it, or maybe it's a combination of socialization and physical activity exercise. But sometimes that can be helpful too, because not only do they have somebody leading and guiding them through the exercise, but they have people like them around them
Yes.
engaging with the same activity. And so that can be also helpful in motivating your parent or parents to increase their physical activity and exercise a little bit. So there's a lot of different small
Yeah.
things you can do. And I just named a few of them that I think are impactful, at least for our parents and our generation of our parents.
Absolutely. I remember when my daughter started daycare and she was learning to sit down, crisscross applesauce. And she would pull my mom and be like, Nana, sit down, crisscross. And I was like, oh, she be getting down. But you're right. That did motivate. She got down. She did crisscross applesauce with her. And obviously, I think that brings joy. Okay. So now let's move from that to back pain. I almost feel like I don't know if that's the most common. Funny enough, I do see a lot of patients with back pain in my clinic, but I feel like that is just so common. And I don't know, is it common because people aren't mindful of their posture? Is it common because I don't know, they just that's just a more easier part of your body to injure? What is it about like for every five person, three out of five would tell me, "Oh, I have back pain." What causes that? Or there are multiple, but what are some causes to that?
You ask all the hard questions, Dr.
I
T, that's
know.
for sure. No, but back pain definitely is one of the most, if not the most common issue that people
Yes.
will come to PT for, or they'll go to their doctor for and take over-the-counter meds or prescription medications for, right? And
Right.
so what the literature has shown is that 85% of all low back pain is what we call non-specific. So that means
Mm,
is there we can't really pinpoint a
right.
clear structural anatomic cause for that back pain. But what really happens is the back pain that, the regular Joe Schmo, Jane Smith experiences on a daily basis could be due to posture, but it's mostly due to inactivity. And not meaning inactivity, you don't go exercise or you don't do work, but most of our jobs now are
Yeah,
sitting, are static,
that's
right?
true.
And so those patients, those people have a lot of back pain that could be due to their faulty movement patterns,
Mm,
faulty muscle coordination, how their nervous system processes certain signals. And of course, if you're in a static position for a long time, things get weak. And if things are weak, like muscles are weak that support joints, then those joints aren't going to have as much support. So as you can imagine, there's going to be more movement, more shearing, and that can predispose somebody to injuries. And compounding that with poor posture, that could contribute to back pain. But there's a lot of literature out there that says just because you have bad posture doesn't mean you're going to have back pain, right? I mean,
right.
how many times have you seen a coworker or friend that like sits like this at the computer, but they're fine till they're like 80 years old, they're fine. But then you have somebody
Right.
with perfect posture and they're like, oh, my
Right.
back hurts, it's so stiff, and then they have to move around and like stretch their back out.
Right.
So just because somebody has poor posture doesn't mean they're going to have back pain, but it's that combination, right? Weakness,
Mm,
poor movement patterns, poor postural control, what we like to call in physical therapy, and even poor posture, the combination can lead to back pain.
hmm. I would have to say, when I was in, I think sixth grade, I did get like a compliment from another sixth grader that I had the best posture ever. So I do remember it very well. And I
Mhm.
am conscious of my posture. I'm conscious of lifting. I'm conscious of just twisting. Obviously, I'm more knowledgeable, right? But
Mhm.
I think overall, I see women and men with that, we call it kyphosis, where that humpback
Yeah,
look.
the
And I
rounded
get so
shoulders,
like,
forward head.
so I
Hmm.
like sit up even more because I'm like, I definitely don't want to be that. So that is something that is like dear to me. Okay, we have a question in here. I hear birthing anesthesia causes back pain. Is this medically proven? So birthing anesthesia, those that get what's it called? Anesthesia when they're about to deliver, where they get oh my god, somebody help me.
An
The
epidural?
numbing medicine.
Say it again.
Where they get the numbing medicine when they're about to deliver their baby.
Like an
Why can I
epidural?
think of it?
Is not on
Hmm.
it? Not
Sorry?
epidural?
Epidural. Oh,
Yeah.
thank
Okay.
you. So does epidural cause back pain? And is that medically proven?
I haven't heard of epidural causing any back pain. I mean, the trauma from childbirth could contribute to the
Yes.
back pain one feels afterwards. But having an epidural doesn't necessarily cause back pain, just because it is just a medication that does kind of numb the nerves. And then it comes back right after several hours. But it might be the positions you're in, the trauma that you go through, the woman's body goes through after labor. And then, the whole pregnancy, you've been carrying a whole
Mhm.
being in your body that's basically weighing and pulling on your spine, right? And so a lot of times after pregnancy and a lot of labor, so a lot of women might have pain afterwards, not necessarily from the actual labor itself, but maybe from all the accumulated effects and the change in their bodies right after labor. That could be leading to pains and stuff like that they might feel afterwards.
Yes, and I can add a little bit. And I'm sure if I add all of this, Dr. Brusola will give more. Your core and your back, they're like a corset. And so if you look at it as a corset, so look at this being like your abdominal, your stomach, and this being your back. With pregnancy, this has grown. So this has stretched, which puts more pressure on your back. And so I think we feel it more once that pressure is relieved a little bit. So it's almost like, oh, is it the epidural? I don't necessarily think it is either. I think it's the distension of your stomach, and I think positioning plays a big role. I was, rolling on my side. I was trying to get on all fours. I wasn't just laid on your back. For a woman, and sorry to the man here, but reality, for a woman, you're laying on your back with your legs up for a good amount of time. And like Dr. Brusola talked about, that static position. Some women are in labor 2 hours, 3 hours. Imagine sitting in one position for so long and then you get up. You're going to feel that soreness. You're going to feel that tugging. So I don't think it's necessarily the anesthesia. I had an epidural. I didn't have any back pain. But again, I was mindful of positioning because I wanted to make sure that I was mobile and things like that. So may not be the full answer, Queen underscore Vaughn, but at least from what I've seen and what Dr. Brasola has seen, it's not necessarily the epidural because
Mm.
medication can't really cause that kind of pain. It is a muscle imbalance somewhere that is causing that pain. So correct me if I'm
Yeah.
wrong, Dr. Brasola.
No, I think you hit the nail on the head, and I probably have to go back into the literature to really
And he
delve in,
will.
make
He's a
sure.
researcher. He will.
Yes, and really make sure that there isn't. But I haven't heard of any, and I've seen a few patients, women postpartum for some rehab, and I haven't heard of anything like that.
Yes. Good. Quinn underscore Vaughn, he's gonna send me some research. Watch. But I'm just gonna forward them to you because
There
I'm
you
not
go.
reading all of that. Because Dr. Brusola likes to be factual. So he's gonna go in tonight and like figure it out. Okay, please keep dropping your questions into the chat about just if you've had any experience with physical therapy, any questions. There is no silly question when it comes to this field. Our goal here is just to inform and to educate. Well, I wouldn't say before. Most times when I speak to people and I ask them, what is physical therapy? The first thing that comes to mind is either back pain or I got into a car accident. And because I got into a car accident, I have to go to physical therapy. And so, what are some common injuries that, if someone were in a car accident, as little as a fender bender that they could experience that could actually have them come to physical therapy or make them need physical therapy, I should say.
I mean, the
Miss?
most common injury that you might get, especially if you get rear-ended, would be whiplash, right? So a
Yes.
lot of neck pain, headaches that could come with the whiplash, and we might see them in physical therapy to help with the pain, reducing the pain. And a lot of times after a whiplash injury, with the pain, the nervous system gets shocked. And so a
Yeah.
lot of times the muscles around the neck, the shoulder area don't know what to do. So they just go like this, right? They just grab onto dear life. And so that's why there's a lot of tension there afterwards. They have a lot of headaches and you feel kind of like this pain, like coming from the back of your neck, going all the way to the front of your head. And that's because of the mechanism of the injury, the whiplash, that's causing those muscles to really tighten up. The nervous system goes crazy, the nerves go crazy, and they don't know how to calm down. And so physical therapy, we can teach you exercises, we can give you exercises, and we can do hands-on work to help calm down that nervous system, and get those muscles coordinated and working again like they should be, to help reduce the issues with whiplash after a fender bender or a rear end accident or anything like that. But most commonly, whiplash is kind of the big one. If you hit your head on the, what do you call it, the steering wheel or the back of the headrest, then you might get a concussion, right? If you black out for a little bit and then you wake up a few couple seconds later, that's a concussion, and that's what we call a brain injury. And that can lead to a lot of issues that you would need to see a physical therapist for, to get what we call concussion or vestibular rehabilitation, to work on reconfiguring that vestibular nervous system connection, so you don't have a lot of that concussion issues, the headaches, the double vision, the auras, the migraines, the discombobulation, the confusion, the brain fog, all that stuff.
Okay. Yes, I've seen a few whiplash. So even if you're in a car accident and you're like, oh, I just kind of hit my head a little bit, but I'm okay. I kind of like bounce back. Please go get checked out. Please go see a PT. Things build up. Sometimes you may not feel it right away, but it may come out a little bit later.
Yes. And like we talked about, early intervention is better, right? Even if you don't feel anything, there might be something there that might be what we call subclinical. So you don't really feel it, but maybe until a year down the line, a couple of years down the line, and you're starting to get headaches for some reason out of nowhere, or your shoulders and your head start to hurt more, and you're like, what is going on? It could be because from that accident you had a couple of years ago, and you never addressed the underlying issues that you may not have felt initially, but we can test for and find out and assess for as physical therapists and address right then and there, so they don't become something chronic later on. So if you're ever in a car accident or you ever get injured, it's always good to get checked out, just to make sure there's nothing going underlying that could become worse later on.
Yes, because we think whatever happens now, we see the symptoms now, not necessarily. I have patients that I can, I can track back their history to 10 years ago about something, and they never took care of it. And now it's showing up in other areas. And now it's kind of like, oh, I probably should have gone to PT. Another thing I want to touch about, or like another topic I want to touch on, is vestibular. We call it the vestibular system. But I'm also getting a lot of patients who are telling me they kind of just feel dizzy. Dizziness is something that I know that obviously it's not normal. But I hear people that come in and say, like, oh, sometimes when I just get up, I get a little dizzy, ooh, but then I'm able to go about my day. And then I'm like, okay, you need to kind of get that checked out, because that's not normal, right? Can a PT work with anyone that has any dizziness?
Yeah, PTs can definitely see people with dizziness. We do a full evaluation to determine what's the cause of the dizziness and rule out other things that could be more serious, that could need some medical intervention. But for the most part, physical therapists can see patients who are dizzy. And the most common, right, is, I think the most common one that we might hear in terms of symptoms is, I get up from bed or I roll in bed and then everything's spinning. I'm spinning or the world's spinning, so vertigo. And that's something physical therapists come to us, we'll fix it day one, honestly. For most people, fix it day one. But maybe some people could be more chronic in terms of what the dizziness are, because we'll rule things out like your blood pressure. If a lot of times patients' blood pressure, especially if they're older or if they have neurological conditions, changes or poor control of blood pressure can lead to dizziness and falls and injuries and all that stuff. So we rule out things like blood pressure, medications that could be causing dizziness, or other nervous system issues that could be causing dizziness. And that's part of our full evaluation for balance and dizziness. And of course, vestibular our patients with vestibular issues. So definitely come to us if you feel that you're dizzy, you're getting dizzy, because it's definitely not normal to be dizzy.
No.
Um, if you have a symptom of dizziness, that should tell you there's something going on with my brain and nervous system. Either the signals aren't getting processed right, they're not getting, they're not connecting right,
Mm-hmm.
or there's something else going on. So I need to get it
Right.
checked out. And physical therapists can do that evaluation and tell you if it's something that we can fix or if it's something that you need to go see your PCP about.
Yes, absolutely. Headaches, dizziness, migraines, all of that. Those are all things that you're more than welcome to go see your PT for. Your insurance will cover these things. I did a live a long time ago about insurances. Your insurance will support whatever diagnosis that you may have. And even if you don't have a formal one, you can still go see a physical therapist. In some states, we do have autonomy, meaning that you don't even need a referral. You can go straight out from the streets and go see a PT. In some states, some PTs still do need a referral. So you just want to kind of check with your state laws and see, okay, can I go straight to a PT or do I have to go to my PCP and then go to a PT?
Mhm.
That's been a major change in the field. I think it's worked for so many people. I get people that just call me and say, my dad is falling. Do I need to go here? Da, da, da. Like, eventually, I do get a referral, but the clinic will help you with that because you want insurance to pay for it. But I say, hey, bring your dad in right away. Let's do an assessment. Let's make sure that he's safe and things like that. So I know I'm supposed to be the interviewing. I can't help it. This is my field. I love
I mean,
it.
it's something we both had to deal
Yes,
with, right, as PTs, and so, uh, yeah.
absolutely, absolutely. I want to segue into surgery.
Hmm.
Um, I love we have medical professionals here on this live, and this is again this is just information purposes only. We're not swaying no surgery, yes surgery, but I do get a lot of patients that, let's say, they have back pain and they go see their doctor, and the first thing their doctor wants to say is, oh, I think you need a fusion, or I think you need a laminectomy, or there's the first thought is like surgery. So they come to me and say, hey, I need your professional opinion. Do I need surgery? And should I tell you what I tell them? What I recommend, and this is Dr. T's recommendation, I let them know that if you're not able to function anymore, then that could be a possibility. And if you have tried all the non-invasive techniques, have you gone to PT? Have you changed your diet? Have you talked to a nutritionist? Have you changed your lifestyle? Things like that. What is the cause of this back pain? What is the I dig really into, like, once you have surgery, that doesn't mean your pain is gone. Once you have back surgery, you may come to me with more pain. And then now we're going through pain management and things like that. So that's what I tell my people. I'm sure we have some surgeons in here, or they're going to watch this and they're like, come on, Dr. T. Right. But I do all of that first before saying, go to surgery, or I recommend surgery. What do you do, Dr. Brisola?
Oh, so it's a very case by case basis, right? So
Right,
so again, it's a complex issue, right?
right,
What's causing the back pain? What's going on? And a lot of that conversation, happens with the patient and the surgeon. It should happen. Like, why something is happening, like why you're having the back pain, right? And the pros and cons of surgery, right? And the pros and cons of not having surgery, going through conservative treatment like physical therapy first. What I always tell my patients is, if physical therapy doesn't work and your conservative management, other strategies don't work, then surgery can be an option for you. But if you go through surgery first, that's non-reversible, right? Once you've cut and you've done things in there, you can't reverse that.
right.
And so the outcome, there are good outcomes with back surgery, but there are also poor outcomes with back surgery. It depends on the individual, right?
Right.
And just because you get back surgery doesn't mean you have 100% pain free. It could help you reduce the back pain, but that doesn't necessarily mean it's going to be a guaranteed 100% pain free life after that. It could come back later on,
Right.
right?
Right.
So that's where, we really, really do, depending on the cause of the back pain, I really do push for conservative treatment first, because we can help you manage your back pain, reduce your back pain, get you back to being active, doing the things you need to do without the risk of that comes with surgery, infection, etc., blah, blah, blah. Like when I was working at Tier, I'd see a lot of patients who became paralyzed after back. I'm not trying to
Wow.
scare anybody, but it
Right.
can happen. Or
Mhm.
I've had a lot of patients with spinal cord injury, or what we call cauda equina syndrome, because something got nicked
Yeah.
in during surgery and they lost control of their legs, for example. And now they have to not only deal with that back surgery, but now they have to do rehab for their spinal cord injury, their paralysis, essentially. So there's always a risk
Surgery.
with surgery, but for physical therapy, the risk is super minimal. I mean, the only risk you have is maybe you spend 3 months in PT and it doesn't really make a dent in your pain, but that's better than what might, again, the risks that come with surgery, right? And so
Right.
I always encourage my patients, if you haven't done conservative treatment, PT, before, give it a couple of months, give it 2 or 3 months. If you don't find that the pain is reducing, or you're able to do more despite your pain, then that's where maybe you should go back to your surgeon and consider other options that might be available to you. That might not be surgery. It could be like injections also, right? It could be other type of pain management strategies that might not be surgery per se. So surgery, again, I'm not a first line proponent of it. It never should be a first line of defense for most situations. For some situations, obviously surgery is necessary, but for most people that come in with back pain, non-specific back pain, for example, surgery shouldn't be the first option.
Okay. Thank you for that. So I'm going to ask a real question
Okay.
that I'm sure people are thinking and don't want to ask. But does physical therapy really work?
Depends. It's
Does
all in
it?
your mind. Just kidding. I'm kidding. No, 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 no. People, yeah, I have a lot of people. I've heard a lot of people say,
Mhm.
well, it, my injury will just get better anyway, even without physical therapy. It might as
Right.
well could. But guess what?
Mhm.
Would you rather go to PT and have your injury heal in a month, or not go to PT and have it heal in a year?
Yeah.
Right? Would you rather go to PT and have your pain reduced, your function improved a lot faster? Or would you rather not go to PT and suffer and
Right.
be less functional, less active because of the pain or the injury for a longer period of time? And then later on, maybe you're never back to, it's never the same again, right?
No.
You're like, oh, I'm never able to put my weight on that leg the same, or run the same, or walk the same. So are you willing to risk that versus spend 4, 6, 8 weeks in PT and get things healed up correctly?
Right.
So you'll always heal. The body is amazing. It'll heal despite
Yes.
any injury. Sometimes it heals really well. Sometimes it
Yeah.
heals the wrong way. And that's where, again, physical therapy can nudge and push the body to healing the right way. Because a lot of times we just let things heal by itself without any specialized intervention or exercise or anything like that. Things can scar over,
Yeah.
things can get restricted, things can stop moving the way they used to move or they should be moving. And so that can lead to more issues down the line. So, again, physical therapy is um, useful.
Yeah.
It does produce results. And the scientific literature shows that. Physical therapy can accelerate healing, can improve the outcomes post injury, and get people back to their functional activities, their recreational activities, work related activities a lot better, a lot faster. So, you know,
Perfect. Thank you for that. And I think this is a good overview of this field. I don't know why. I think even sometimes when I look up what is a physical therapist, I don't see much more than just have you been involved in a in a car injury or things
yeah.
like that. So I think this is a very good behind the scenes or foundation to it. One more
And I just
question.
wanted to say too,
Yeah.
you can see a physical therapist for anything, right?
Yes.
You can come to us even if you don't have an injury. If you want to make
Mhm.
sure you're healthy and you're moving right, and you want to maximize and optimize your movement and your function for the sports you do or the work you do, come see a physical therapist, and we can make sure you're strong enough, you're stronger than you should be. You have the range of motion, you have the capacity to, keep doing what you love doing for a longer amount of time, for a longer period of time. So don't just come see us because you have an injury or you think you have an
Right.
injury. Come see us even when you know you're well and you're
Mhm.
healthy, because we can maximize your health, optimize your well-being and your movement
Mhm.
through our interventions.
Good point. Very good point. Before you got on, Prince Cato, I don't know if he's still on, he said something that I think is also common. Because I was asking everyone how's their Monday going, and he said he just drove from Shreveport to where he lives, which is about 5 hours. And he was like, my back hurts. So is there something, or what are your what are some recommendations for someone that, let's say, he's kind of like, I don't want to stop, I'm gone, I just want to drive, but this is a long ride. What are some things that he should do or he can do in preparation for his back in such a long drive?
Those like we had mentioned, right? The long duration static
Yeah.
postures are, not good because they
Right.
make things stiff, right? And so if you don't want to stop, which is what I usually recommend, stop once or twice, go for like a
Yeah.
minute walk or something, do some stretches outside, and then go back and drive. Like that's a couple minutes out of your drive, right? Out of the 5 hours. And that will save you your back pain, right? But if that's not something you want to do, then changing your positions in the car. So changing the recline, changing the seat angle, changing how close you are from the from
Steering
the
wheel.
steering wheel, for example. Those are good things to do, like changing those every hour or so. You can also do some what we call pelvic tilts as you're sitting
Hmm.
down. So that's where you kind of, if you're thinking about your pelvis, you're bringing your pelvis up to your belly button and you're kind of arching your back, and then you're kind of curving your back again and arching them. Doing those 20, 30 times every 15 minutes can be helpful because that's promoting movement, right? So preventing that static posture that could be contributing to the back pain. You could also do, if you're able to, do some stretches side to side, right? Um, uh, Again, 20, 30 times every 15, 30 minutes or so, to get some movements in the sides of your trunk. So even things like that, those movements can be helpful. But definitely getting out, walking maybe once, can be very helpful also to loosen things up, make sure things don't get stuck. And of course, what I also recommend for all my patients is, building up your strength and capacity.
Yeah.
So if you don't exercise regularly, then maybe exercising once or twice a week, especially focusing on the back, the trunk, the core, the glutes, can be helpful in minimizing that pain when you do have to drive the 5 hours, 6 hours to get
Mm.
home. So again, building your capacity is one, but also making sure you're moving, even in small ways during that movement, not that movement, during that drive can be
Yes.
helpful. So that goes also to, like if you sit at the desk all the time, right? And change it. If you have a standing desk, stand, sit,
Yeah.
right? Go every hour, go take a break, go for like a round, go walk around your clinic or your office
Office.
for
Hmm.
like a couple minutes, and then go back and keep working again. Again, what we want to do is prevent the static posture and be as dynamic and movement oriented as we can, because that's what our bodies are meant to do. They're meant to move.
Move. Yep. Absolutely. He said, I definitely make it a point to stop and stretch. You go, Prince
Yes.
Cato. Okay, one last question. I thank you, Dr. Brisola. I know I'm like hitting you. And I know I didn't prep you for these. So he's like, what is she gonna ask me next? I don't know if you've done it. I don't recall. For those that do like this CrossFit, this high intensity plyometrics, they're just jumping off jump boxes and they're lifting, I don't know, 300 whatever pounds. What Do they need a? When I see it, let me ask this: when I see these some of these competitions, I don't see people really protecting their backs. Like I don't see them wearing like a belt. I don't see. I don't see anything. I just look at it like, ooh, I wish I could slide them my number and be like, come see me in clinic. But for someone that works out high level, like CrossFit, lifting weight, things like that, what are some recommendations in how they can protect their bodies with such type of activities?
I mean, good question. So a lot of those, like if you watch the CrossFit Games or the high rock stuff, those are really high level athletes, right?
Yes.
So they're already pretty strong, and they've built the capacity to be able to do those lifts, to carry those loads and move those weights the way they move, because that's what they train for, right? They specifically train to do those things. And if they have the technique, then it's all good. But for, if you're just joining CrossFit or you're like, oh, I want to join CrossFit or I want to do high rocks and you just go at it without having done it before, that's when injuries can occur because your body isn't ready for it. It's not strong enough. The joints don't know how to move that way. The muscles don't know how to contract the right amounts at the right times during a lot of these movements. And that's when injuries can occur. So that's where, if you're trying to do these things, you're trying to get into CrossFit or something like that, is to start slow. Learn the technique first. And then once you learn the technique and you've, built up your strength, then you can start doing a lot of the other crazy stuff that they might do. But again, if you have never done, even bodybuilders who go to the gym and they decide to do CrossFit, they get injured really fast, especially them because they're like, oh, I do these lifts, I can do these lifts, and then they do the lifts and then they tear something in their shoulder, or their back goes out because they lifted faster than what they're used to lifting. And so that's where even for athletes who are from a different sport should also gradually increase their
Mm,
loads
yeah,
and their progress in these things. I mean, it was funny too because
absolutely.
pickleball is like a big thing nowadays, right? And
Yes.
then I can't tell you the crazy statistics in terms of, I don't remember what it is, but the injuries in older adults
Yes.
like skyrocketed when pickleball came out. The big correlation, who knows? But it's because all these older adults decided to go into pickleball. It's like, oh, this is, easier than tennis. I
No.
can do this, and they sprain their ankle, they
Yeah.
throw out their back, they fall,
Yes.
they hurt their knee. And so again, it's starting slow, get the technique right, and then you can start doing all the crazy stuff. And then you can come to a physical therapist, especially if you start and you're like, oh my gosh, like the soreness isn't going away like it usually does, or my back is like pinching a little bit, right? See a physical therapist right away, get that fixed right away,
Yes.
and then you can get back to doing what you want to do.
Absolutely. We have two last questions in here. I'm going to go to Triple A Mom 823. You took my last question, so it was meant to be a good question. I'm going to go to Quinn underscore Vaughn because we kind of touched on this earlier. You said your dad is over 80 and still fit enough to climb ladders, LOL. What are daily activities you recommend for long-term great health, body, muscle, bones, especially if we're not gym folks? Are you 80 Queen underscore Vaughn? I'm joking.
You don't want to
Quickly,
age her. You don't
quickly.
want to age her. Well, say she's
No.
21 or they're 21. But the best activity you can do is walking,
Yes.
right? Not necessarily like I can't do treadmill. I will die if I
Me
try to do
too.
a treadmill. Just because from the boredom, like I'm just like staring at the same thing for 20, 30 minutes. Go walk outside, right? Especially now that it's getting cooler. Like my dad walks in the morning every 2 miles every
Mhm.
day, or at least
Wow.
tries to every day. So walking is one of the best things you can do for your health.
Mhm.
It's great for your bones. It's great for your
Yes.
cardiovascular health. It's great for your muscle strength, especially in the legs. People, like, oh, walking doesn't do anything. It does a
A
lot.
lot.
You don't have to run to be fit. You can walk to be fit. So
Mhm.
walking is a big one. Go hiking, that's always fun. So that's always a good thing. If you don't like that, then biking can be a good
Mhm.
option too. But something cardiovascular, at least, 2, 3 times a week minimum is something good, something aerobic like that. And then I do definitely recommend something resistance based because that's going to keep your muscles strong, especially in the upper body. And it doesn't have to be the gym. You could open up an app and do body weight
Yeah.
exercises, right? And then you can supplement. 10, 20 minutes a day, 2, 3 times a week of that. You can just do two days a week, and that's fine to keep yourself strong. So 2 days a week of resistance exercise and 2 days a week of cardio. It's not too much, especially
Not too much.
if you put it together. And again, the cardio doesn't have to be intense. It could just be 20 minutes a day. And guess what? It doesn't have to be 20 minutes straight. You can do 10 minutes in the morning, 10 minutes in the evening. But at least you're getting those steps in. And you know, there used to be that 10,000 step rule.
Oh my
It,
gosh.
right.
No,
Yeah.
no,
It's based on you, right?
no.
Don't I mean if you want to aim for 10,000 because you never do 10,000, you do like seven, then yeah, why not, right? Set a goal for more steps, right?
Mhm.
That's something you can do. But yeah, um, yeah.
Thank you for that. Very good. All right, Quinn_Vaughn. I want to see some pictures or some Instagram stories of you walking because now I'm going to hold you accountable. All right, last question. And this is a big one, so we'll keep it brief because we're running out of time. What particular problems are more indicated for occupational therapy versus physical therapy? That was actually going to be my last question, is the difference between physical therapy and occupational therapy. But yes.
Okay, yeah, good question. And this is the question everybody has, even some
Mm-hmm.
PTs and OTs, right? They're like, what do we do again? Or like, how are we different from the other people? No, but yeah.
Right.
So if you have a problem with what we call your day activities of daily living, so these are your more fine movements. Think about it like dressing, cooking, um, doing your bills, like writing,
Mhm.
typing, doing household chores, doing your work related things at your actual occupation, your job. So if you have any issues with those, you would see an occupational therapist. And we usually see these patients go see an occupational therapist with hand arm things going on, right? Because we use our arms, use our hands a lot for our work and our occupation, for cooking, for dressing, for self-care, brushing our teeth, all that stuff. We use our hands. That's why we see occupational therapists when we do have hand arm issues, is for that very reason. Because our hands are so tied to what we do in our daily lives that
Right.
occupational therapists, that's their specialty, is how do I get you moving again so that you can do your self care, your grooming, your bathing, your going to the bathroom, your actual work job responsibilities,
Mhm.
cooking, cleaning, doing the lawn work, driving, etc. So all
Yes.
those things are usually what occupational therapists will do. Physical therapists, I like to say, think of us as the overall mobility movement gurus. Like, we will help you walk again. We will help you with your knee injury. We will help you get up from the floor again. We will help you go up and down the ladder again, right? So all the
Yeah.
big movements, all the general movements, the mobility, that's what physical therapists work on. We can also work on a lot of the things that occupational therapists work on, but when it starts getting to the nitty gritty, what we call also the functional cognition, like the
Right.
steps involved or the different like my nuanced strategies of how somebody would hold a particular item and bring it to their mouth. Those are all occupational therapists. That's what they learn in school, and that's what they specialize in, is how do I do all these activities that I do in my daily life um, again.
So if they can't get a hold of an occupational therapist and they want to, I don't know, work on toileting, can they go see a PT for it?
Oh yeah, for sure. They can definitely see a physical therapist for it, but not
Okay.
all physical therapists will have the same skill at
Yes.
that, possibly. You'd probably
Yes.
have to find a specialized PT to get a lot of those things. And for the people who need some of the toileting, going to the bathroom stuff, usually are patients with neurological injuries, so seeing a
Neurological.
neuro
Yeah.
specialist, or maybe are patients with pelvic dysfunction, so seeing a women's health or pelvic specialist can be helpful.
Yes. Awesome. This was really good. This was really informational. I know someone somewhere will kind of go back and just be like, I don't even know what a PT is. And hopefully they reach out to the Health Hub and search and see Dr. Brusola and watch this video. But thank you so, so, so much for just coming and sharing your knowledge. I know you have way more knowledge than, me just picking your brain here. But thank you so much for coming. This is going to be uploaded to the Health Hub with Dr. T's YouTube page, as other previous lives. So please go on the YouTube page. Please subscribe, like, and just so that you can see more upcoming lives coming. We have a oncologist breast surgeon coming on. We have a CPA coming on. We have a speech therapist who specializes in patients with autism coming on. So I am really going through my Rolodex. So there people who still have Rolodex. I'm rolling through and trying to bring as much information as possible. So please, if you haven't yet, go on the Health Hub with Dr. T's YouTube page, subscribe, like, and share. Thank you, Dr. Brusola, for just joining. Are you accepting patients? Do you still see patients?
Not that much anymore, Dr. T. I'd have to refer them to you.
Call
To
me
Rock Rehabilitation.
to Rock. Call
With
me
multiple
and I will
locations.
get you to Dr. Brusola. Call me and we'll make something work. If you have
Go.
an issue that you want Dr. Brusola to treat, we got to keep his license up to par. Thank you all so much. Thank you, Dr. Brusola, for joining
Thank
us.
you.
I think our next live will be something active outside.
Oh, that'll be
And
fun.
actually, yeah, and actually do like a little exercise regime
Oh wait,
so that
our
people can
next
see.
live, or are you saying your next live? Oh, our next live.
We're
Okay.
gonna do another live, but we're gonna do an outside exercise live. So thank you
Okay.
all so much for joining. Happy Monday. Have a great evening and a blessed rest of your week. Thank you so much for all the new people that joined. Please follow the Health Hub with Dr. T. Please follow the Health Hub with Dr. T. Thank you all so much. Have a great evening. Thank you, Dr. Brusola.
Bye. Thank you. Good to see all of y'all.
Bye. Bye, everyone.